When I was born, there were 2 billion people in the world. Today, there's 7.4 billion. And the population of the world is growing more rapidly than it ever has in the whole of human history. Family planning depends upon 3 priorities: access, access, and access.
David Malcolm Potts was born in England in 1935 and graduated from Cambridge with degrees in medicine and embryology. From an early age, he had a knack for effective communication and widely respected for his ability to tell a story in plain terms on any medium, especially on complex scientific concepts. Not surprisingly, he was a natural pick in 1968 to be the first medical director of International Planned Parenthood Federation. A decade later, he was recruited to the US to develop and lead the largest non-government HIV prevention program in the world. We recruited Malcolm to Berkeley in 1992, where he spent 3 productive decades inspiring newly minted advocates for reproductive autonomy, while also becoming the most popular professor ever on the Berkeley campus. It's always hard to be the first to do something new, especially when it is controversial. But this was Malcolm's forte. Throughout his work, he managed to remain unjaded even after decades of pushing through barriers. Yet, even into his 80s, he managed to stay committed and energized. Now over to the professor himself, Malcolm Potts.
I'm a British-trained obstetrician, and I've been interested in family planning since I was a young doctor in London. Abortion was illegal, and every night I had to get up and clean up somebody else's incomplete abortion. Nobody died, but I just thought that was a terrible way to treat women. So I began to offer them contraception. And the standard answer was, I was just going to ask you that, doctor, which was a code for saying I never would have done. But then the consultant to whom I was responsible said, obstetricians don't do family planning. So I was young and I did it. And it's been really the rest of my life. I started working internationally in 1969, went all over the world, saw very dramatic and welcoming declines in fertility in South Korea, in Thailand, in Taiwan, in Sri Lanka, in some parts of India. Then I saw the same thing happen in Mexico and Brazil and Colombia. And now I'm very interested in Africa, which is the last continent to see these changes and the ones that now need it most. When I was born, there were 2 billion people in the world. Today, there's 7.4 billion. And the population of the world is growing more rapidly than it ever has in the whole of human history. This year, there'll be more than 80 million more births than deaths. That means we have to fit a new Germany somewhere on an already overcrowded planet. And that exponential growth is going to continue, and we're probably going to have 10 billion people or so by the end of the century. And I think there's a real challenge as to whether we can feed that number of people. The only thing that's growing faster in our population is our economies. And so the impact of human beings on the planet doubles every 17 years. That is, if you take the rate of population growth and add to it the rate of economic growth and put those 2 things together, we make twice the impact on the planet every 17 years. And you can't do that for many doublings before you destroy the planet. So I think one of the existential problems facing the next generation is, can we create a sustainable economy with a balanced population and a reasonable wealth for people without destroying the biosphere, or without irreversible damage to the biosphere on which all life depends. We can destroy the oceans, we can destroy the land. And so for the first time, really, since the meteor destroyed the dinosaurs, one animal can destroy the planet. Now, there is good news. I mean, I've seen, when I first went to South Korea, people were having 6 children. Now they have 1.8. And as a result, their economy has boomed. South Korea is a fairly liberal country, good education, better health services than the United States of America. That would not have happened if they hadn't focused on family planning at the very beginning. The Ministry of Finance put a lot of money into family planning, told the Ministry of Health to get on with it. They made a range of contraceptives available. They had changed the abortion law, and now they're a successful country. Same thing in Thailand, same thing in Sri Lanka. But there are other countries like the Philippines where it's difficult to get contraception because of the Vatican. So if you look at Thailand, the richest 20% of the population have slightly fewer than 2 children. The poorest 20% have about 3 children. There is some inequity, but it's not gross. If you look at the Philippines, the richest 20% have just under 2 children, just like Thailand. Rich women can always get what they want. The poorest women have 2 or 3 children more than the richest women because they cannot get contraception. When you give women that technology, and also men, then family size declines very rapidly, as I've seen it in South Korea, as I saw it in Thailand, as I saw it in Colombia, as has happened in Mexico. I'm an evolutionary biologist, and I'm not ashamed to say this. I think women have a more long-term view of the world because you're going to bring up children. So I think that for a peaceful world, which we all want, we need to slow population growth, empower women, keep women in secondary school. Going to primary school is important, but it's secondary school that makes a difference. That's what pushes up the age of marriage. And family planning is not only something that women want, I think it's a basic human right. Good family planning facilitates good education. Risk of dying in childbirth has plummeted during my lifetime in developed countries. I've prevented many more maternal deaths by making family planning available than I could possibly do in a hospital by ligating people, giving them things to stop them bleeding or doing cesarean sections. Similarly, family planning reduces infant mortality, because if you have your children too close together, those children get infections from each other, they have to share the resources of their mother, they die more rapidly. Whether they're in the United States of America or whether they're in Burkina Faso, children that are too close together have a higher infant mortality. So if we help women to space their children, we could save literally millions of infant deaths every year. So we have solutions to all the world's problems which are evidence-based. We know what to do with family planning. Family planning depends upon 3 priorities: access, access, and access. Give people the choices, give them the information they need to make their choices. I have no right to be in anybody else's bedroom telling them what to do. People can come to me and I can tell them all about the pill, I can tell them about an IUD, I know how to put in an IUD, I can do a vasectomy. Whatever you want, I can do, but the person has to make the choice.
We are very proud of the work we have done. Yeah, it looks fantastic.
So
you should be very proud.
the role of somebody like myself is to get the resources, and for poor people cannot afford to go to a doctor, or they cannot afford the full price of even a condom. So we need to subsidize those things. But globally, the international community puts billions of dollars every year into development. We try to improve agriculture, we try to improve education, we build roads. Those are very good things. We vaccinate kids. Of all the money that has gone into invested in development since 1950, 1% has gone into family planning, a trivial amount. And in areas of Africa where the population growth is very rapid, it's an even smaller amount. Now, if we could get 2% of foreign aid to go into family planning, I'd be a very happy person, because I'm pretty sure I could slow population growth. The United Nations projects that by 2100 there'll be more than 10 billion people in the world. If everybody had half a child more, I mean, it's a strange thing, a concept of half, but I think we know, then there'd be 16 billion people in the world. If everybody had half a child fewer, there'd be about 8 billion people in the world. That would be perfectly manageable. Now, I'm not being arrogant, but I'm absolutely certain that if I can improve access to family planning, I can change the family size in any country by half a child. Because I've seen it happen. I mean, it's not me doing it. I've seen women and men wanting to do that. But it has to be the community that solves the problem. It's not somebody who's got to parachute in from the big city or somebody with a white face like myself telling people in Nigeria what to do. That's not what I want to do. I want to make sure that people have choices. And a lot of my work has been trying to persuade my fellow doctors to be less restrictive, to let people make choices.
Including pills, injectables, and
I don't always know what those choices are. You have to experiment, you have to make mistakes. And sometimes quite extraordinary things happen. I had a friend who was the medical officer of health for Mumbai, very busy city with very large slums. And he was asked to make vasectomy, male sterilisation available. So he found a few doctors who can do this, and of course nobody wanted it. So he had an exhibition, and he had a panel about the pill, about IUDs, about male and female sterilisation. And he put this in various places, not many people saw it. Then he put it on the railway station, probably one of the busiest station in the world. Hundreds of thousands of people. There's more people outside the trains than inside. And they would bump into this exhibition. And there was a man standing beside the panel on vasectomy, and if somebody seemed interested, he said, well, would you like this procedure? And if the man said yes, he said, come to a hospital at 5:30 on Tuesday evening, and gave him the address of the hospital. And lots of men put their fingerprints or wrote their names down, and none of them came to the hospital. So my friend went one day and watched a man on the railway station, talked to the counsellor, put his fingerprint there, and he went up to him and said, do you want a vasectomy? And the man said, don't be stupid, I live on the pavements. I've got 5 children, I don't want any more. Of course I don't want any more. So my friend Dadabai said, you're going to come to the hospital on Tuesday evening? And the man said, no. And my friend shook him. He said, how can you be so stupid? And the man fought back. He said, if this operation's as safe as you say it is, why do I have to go to a hospital? Because in hospital, people only go to hospitals in India to die. And Dada realized that facts don't matter, it's people's perceptions. And that's not a stupid thing to say if you live on the pavements. That's where people do go to die. So Dada was a bit impulsive like I am. He said, supposing I did the operation on the railway station, would you have it? And the man said, of course. So next day he had a little tent, he had a little table, he had a little stove that would take camping, and he started doing vasectomies on platform 9. And in 1 month he'd done more vasectomies on one railway station platform than in all the hospitals of Bombay in the previous year, because it met people's perceptions. And I know that story is true because I learned to do vasectomies on Bombay railway station. I taught people to do them in other parts of the world, in hospitals and clinics, but I learned it on a railway station. And it was a rather fun place to do it. There were no antibiotic-resistant bacteria on a railway station. There might be some cold grit. But understand people. Go on doing things. Go on pushing the envelope until you find the solution, even if it's not one you expect. And then build on that.
the blue one, I think.
Family planning is not telling people what to do, it's listening to what they want.